So my name is Karen Ray. I'm an associate director here for Gettysburg College in the Human Resource Office. So I'm associate director of HR. We're located on the first floor of Penn Hall. So if you ever want to stop by and say hello, I certainly would welcome that. I have many different focuses, but I would say my main focus for HR is benefits. So I'm the person here that our employees come to as new hires to learn about the benefits, and I help get them enrolled in all the various really very rich benefits that we offer here at Gettysburg College. So I was honored to ask to present for your J term. So hopefully I will give you a little bit of some tips and knowledge on what you should think about and what questions you might want to ask when you start down your career path, which I imagine is coming up fairly soon for you. So let's just go ahead and it's a little slow here. Hang on. Okay, so our agenda is pretty simple. We're going to go over some basic terminology for health insurance. I'm going to talk to you about an HSA, which is a health savings account. And then we're going to talk about a really important topic to me, retirement. So we're going to jump in with health insurance plans. There's a lot of different types of health insurance plans, but I'm going to focus on two basic ones today. But before we do that, when you first get your job, you're going to want to, first of all, if you move to a new area, you're going to want to just simply Google best health insurance companies in this area, especially if it's a new territory for you and you're moving away. And talk to as many colleagues and people that you know in that area. You know, what health insurance do you use? Does it work out well for you? Some employers like us, there's one health insurance company. It's Highmark Blue Shield here in South Central Pennsylvania. There's not as many companies that compete with one another. But if you move to a larger city, that your employer might have 2 or 3 different health insurance companies for you to choose from. So you're going to want to do a little research before you jump in and choose one. Once you do choose your health insurance plan, you're going to want to definitely go on and set up an online account. Set up that username and password. That's going to give you access to all kinds of health information. It's going to let you know how much money the insurance company paid on your behalf that year, how much you paid that year, what your deductible and some of the things we're going to talk about in a minute, how far along you are with those payments. So most insurance companies have pretty cool websites in today's world. They have a lot of hidden benefits as well, that if you go in and kind of dance around on those sites, there's a wealth of information. How to find a provider. Again, if you're in a new area, they all have find a provider search engines that you can go in and say, hey, I need a new primary care doctor. I'm looking for a cardiologist, and they'll be able to point you in the right direction. They also have cool things like cost estimators. So if you had to have a surgery or some kind of big procedure, they'll be able to kind of price it out for you and say, well, this hospital is going to charge this much versus this hospital is going to charge this much. And this is the quality of care you get here versus here. So definitely go in and look around whenever you have your health insurance company and be kind of proactive. Some have hidden things like hidden gym memberships. So again, it's a good thing to do. Go in and get signed up once you're enrolled in the health insurance plan. They also have cell phone apps, of course, that make it convenient for you. And then you also want to make sure that you have a primary care provider. So again, if you move to a new location for your job, you want to, before you get sick, find a primary physician. Call them and say, hey, I'm new to the area. I'm working wherever. Are you accepting new patients? And get established with them. Maybe even go in and meet them if you want. Because it's going to be hard to find a physician when you're not feeling well. So you want to be proactive and kind of do that ahead of time. And your primary care physician is the one who takes care of all your health essentials like routine vaccinations, physical exams, preventative screenings, all of that good stuff that we're supposed to do. So here's some basic insurance terms. Not expecting you certainly to remember these, and you can pretty much Google them when the time comes. And they really won't mean as much to you until they start meaning something to you when you start using the plans. But the basic nuts and bolts are your premium is the monthly amount that you and your employer pay so that you have health coverage. So basically, how much is this costing me out of my paycheck to have this health insurance? You're definitely going to want to know that. And every employer has a different way of deciding what the premiums are. Fortunately, most often employers pick up a big part of that tab, but we employers are going to have to pay our share. And so here at Gettysburg College, for instance, And most employers, a single person is going to pay less than a two-party, which is going to pay less than two parents and several children. So there's like single, two-party, two adults, or two adults and children. And so depending on what category you're in is going to determine how much of that share you're going to have to pay in premiums. We also here at Gettysburg College break it out by salary. Now, not too many, I don't know how many employers do this, but you know, the lower salary you make here at Gettysburg College, the lower premium you pay. So the people who make more money are going to pay more for their health insurance. And it's just, we think it's just a very nice, fair way to do it here. And it works well for our Gettysburg College family. So that's what a premium is. Your copay is the set amount that you pay for health insurance service before your plan starts paying. So you might have, you know, you might be familiar with this. You go to the doctor, you give them your health insurance card, and they say, okay, it's a $20 copay for this visit. If you go to a specialist, it might be a $40 copay. If it's a virtual telehealth medicine, like we're doing here on Zoom, it might be a $15 copay. So you might be familiar with that term. Deductible is the amount you pay before your health coverage kicks in. So a deductible is tricky. It's kind of used in different ways depending on which health insurance plan you're on. And I'm going to talk about two different health insurance plans, and you're going to see how that deductible is used very differently depending on which plan you're enrolled in. Co-insurance is the percent you owe after your deductible. So often the employer, the insurance company will pay 80 and you have to pay 20%, or like here at our plan pays 90-10. So you'll see what that co-insurance split is. And that usually comes into play, say you have something big, like a big surgery coming up, you're getting your appendix out. You'll have to meet your deductible. And then after that, you're still going to be responsible for 20% of that surgery cost up to the next term out-of-pocket limit. So, you know, one scenario could be you have a $1,000 deductible to meet, then you have this $10,000 surgery, so you're going to pay $1,000 for your deductible, then you're going to pay 20% of that $10,000 surgery up to this out-of-pocket limit, which could be $5,000, $7,000, whatever your plan determines it's going to be. So the tricky thing about, you know, me telling you about health insurance plans is they're all different. So every employer kind of works with and negotiates with health insurance carriers what their plan summary is going to look like, what we're willing to pay, what we want the health insurance to pay, what we think the employee share should be. So it really is kind of comparing apples and oranges when you're comparing several different plans. If your employer says, okay, there's 5 choices for you to choose from, sometimes it can be tricky. So there's a couple quick takeaways that I want you to think about when you come across that. And that is these 2 different basic types of insurance plans. So one is a more traditional PPO plan. It has a lower deductible. You only pay that deductible if something big's going on, like a surgery. But in the meantime, you go to the doctor, you give your insurance card, you pay a $20 copay like we talked about, or a $40 copay for a specialist. But you don't really have to worry about that deductible unless something big like a surgery is going on, or you're getting like a CAT scan, some kind of expensive testing, then you would have to think about the deductible. And these plans are usually pretty expensive. So they cost more out of your paycheck for you to have this type of plan. The second plan is a qualified high deductible plan. And that's what we offer here at Gettysburg College. We offer one plan, a high deductible plan, a qualified high deductible plan. And because it's a qualified high deductible plan, it has something called a health savings account, which we're going to talk about. I'm going to flip pages here back and forth just to explain that. So a high deductible plan is just that. You know, at the college, you're a single person on our health insurance, you have a $2,000 deductible. And the interesting thing is you're responsible for that right out of the gate, January 1. So now if I go to a doctor, I'm not going to pay a $20 copay. I'm going to pay whatever that doctor charges me. Could be $80, could be $120. Prescriptions, I'm going to pay the full cost of my prescriptions. A surgery or something, I'm going to pay it's as if I don't have health insurance until I shell out the first $2,000. That's a kind of simple way to think about a qualified high deductible plan. Your deductible comes first. After I meet my $2,000 deductible, then I'm back to $20 copay, $40 copay, co-insurances and stuff like that. These plans, the premiums are much lower than the plan I talked about in the traditional plan. those premiums are more expensive. So you could think of it like this. Do I want to pay a lot out of my paycheck out of the gate? And then if I have health concerns, I'll pay less co-pays. Or do I want to say, you know what, I'm healthy, I maybe don't have any health concerns. Why should I pay this heavy premium? I much rather pay a higher amount and meet that high deductible when and if I have a health concern. So that's kind of and pay lower premiums for it. So it's kind of like one kind of way that you can think about it. Before I get into the next few sentences, I just want to skip over right away to a health savings account. So this is what makes a qualified high deductible plan so nice. If it's a true qualified high deductible plans, because there's some high deductible plans that don't meet the qualifications of the government, ours does. So it's called a qualified high deductible plan, and that gives it access to a health savings account. So a health savings account, it's a bank account. It's your bank account, and it's a tax-free savings. So the money going in is tax-free, and when you pull the money out to use it for out-of-pocket medical expenses, it's also tax-free. It's the only legal way in the United States of America that you can save completely tax-free. So it's a very strong, powerful savings device. The great thing about it is both you and your employer can put money into the health savings account. We at the college, the employer puts money in every January. If you're a single person on our health insurance plan, the college just puts $750 into your health savings account, your first pay in January. If it's you plus more family members, we put $1,500 into that account because your deductible is higher. So your $2,000 deductible, suddenly the college just put $750 into an HSA that you can use for out-of-pocket medical expenses. Your deductible is not $2,000 anymore. It's, I don't know, $1,250 or whatever the math is. So, and then you also can put money into this health savings account. So if the employer's put money in and you're putting money in, and you have a wonderful year and you don't have any medical expenses, that money rolls over to the next year and into the next year and into the next year. It even rolls into retirement. So this is a really strong savings account for you to start investing in. That bank account is yours. The minute your employer opens it for you and starts putting money in, you could leave the very next day. Doesn't matter. That money is yours to take with you to use for out-of-pocket medical expenses. So like, for instance, I have 4 young adult children. They're adults, some are married and have kids already. But when my oldest son, when he got his first career position, he had a qualified high deductible plan with an HSA. His employer put money in, he put money in. Young, healthy person, didn't use the health plan for many years, like 2 or 3 years. And that money just kept saving. The employer put more money in, he kept putting more money in. Now he's married and has 2 children. He's using that money. So, but he had a really nice cushion saved in the meantime. So it's really nice. So when you have you have this $2,000 deductible, you go to the doctor charges you $80. You don't have to worry so much because well, the college just front loaded $750 into my health savings account in January. So I know I can pay that bill. And most of these bank accounts have really nice dashboards where you can do like a bill pay system. You can just go in there and like you do any bank bill pay and say, hey, pay Dr. Smith $80. They give you nice debit cards where you can just use that to pay your out-of-pocket medical expenses, your prescriptions. You can even there's a whole host of eligible expenses for the HSA, like of course, all our pandemic COVID masks that we have to wear. A lot of over-the-counter Tylenol, Advil, if you need a blood pressure cuff. There's so many different things that you can use the HSA money for. That's really, is really useful through life. The government sets limits on how much we can contribute each year because, again, this is a powerful savings vehicle that's not being taxed. So the government, of course, wants to control it. So this is the limits for this year. A single person can contribute $3,650 in 2022. An employee plus one other person on your taxes can contribute $7,300 in a year. And so this includes both the employee's contribution and the employer's contribution. It also includes your spouse. If your spouse works at a different company or even the same company, and they also have an HSA, you have to communicate and coordinate your efforts because your contribution, your employer, their contribution, and their employer, all of those have to be added up to not exceed the $7,300 limit. So I'm going to just go back if I can. a screen or two. I just want to finish up by saying, regardless of the type of health insurance plan you're enrolled in, at the bottom here, there's always preventative services that we don't have to worry about the deductible, regardless of what type of plan you're on. So preventative services, for women, we get mammograms, or you may go get an annual physical, or your vaccinations, your routine vaccinations, all of those things that are preventative, that the health industry wants us to get those things to kind of catch things early so that we don't get sick later. So don't be afraid to go get those exams, because you don't have to worry about having to pay your deductible. They're always going to be free to us members, and that's regardless of what health insurance plan you have. Also, some people worry about pre-existing conditions. Don't worry about that. It's against the law for them to not accept you onto a health insurance plan if you already have some kind of health concern. And then here's a big one. You see that last sentence? This is good for you to know this. You can stay on your parents' health insurance plan by law up until your 26th birthday. So again, my young adult children, when they first started going out into getting their first career, I have 4 of them. So we were a family plan. So when my first son went off and got his job, it didn't matter to me if he stayed on our plan or went off onto his employer's plan, because I was still going to pay a family rate whether he stayed or left. Now, my youngest daughter, when she graduates college and gets her job, I'm going to want to boot her off, because I can go down to a 2-party plan, no longer a family, and save money on premiums. Now, I won't do that, but I'm just saying, it's a conversation that you want to have with your parents. If it saves them money by you going off and getting your own plan, so be it. But if not, if it doesn't cost them any more, whether you stay on their plan or leave, you might be able to work a good deal out with your parents, and hopefully it'll be free for you to kind of get your footing. And now, you may decide, what, I want to get started on my own, especially if they offer an HSA. I want to start taking advantage of that and building that up. So it's just another option that you have that you want to consider when it comes time to looking at health insurance. So, questions, if you want to jump in, it looks like we're a small group, so you're welcome to just unmute yourself and ask me a question along the way. I'm happy to do that. Or if you want to wait till the end, I'm definitely going to stay on at the end and answer any questions that you might have.
Do you recommend maxing out those employer contributions in the health savings account, like every annual year, right? Every pay year?
If you can, I would say yes. I do that because, again, it's such a great savings account that rolls even into retirement. So even when I retire, if there's money left in that account, I'm going to use it for out-of-pocket medical expenses. So there's always going to be health expenses through life. So you don't have to worry about this money's going into an account that I'm never going to use. You're going to use it. And you can use it for all of your tax-dependent family members. So for instance, even if I have say I have a health insurance plan by myself, but my husband has a health insurance plan with our children, even though they're not on my health insurance plan, they're my tax dependent. So I can use my HSA money to pay for their health expenses. Okay. And then also the reverse is true. If they're not your tax dependent, but they're still on your health insurance, like my 25-year-old son, he's still eligible and can be on my health insurance plan. So he is, but he's certainly not my tax dependent any longer. So he can't use my HSA money for his health expenses, but he can go to his own bank and open his own HSA and put money into it. So that's not exactly what you asked, but it's hard to know, it's hard to spread your money around, because there's all these benefits and different premiums that they're going to cost you money out of your paycheck. You also have to eat and pay rent and do all kinds of other things. And the next section, when I talk about retirement, is going to be a real strong push as well. So it's like, okay, I only have so much money to play around here. Some people don't put money in their HSA until something happens. So say, because they want to get that tax savings. If they have to pay those medical bills anyway, you might as well run it through your HSA and get the tax benefit. So there's all different kinds of ways to do it, Cole, but I would say, yeah, if you're able to put money into this account, you should.
Yeah. I mean, do different, are different HSAs like what you can buy with them? Is that the same across all HSAs, or is it like job specific, health
No.
insurance specific?
No, it's government specific. So the
Oh,
government
okay.
tells us, yeah, the government tells us how much we can contribute each year. They tell us what is eligible to come out of these HSAs. So it's the same regardless of what employer. Now, each employer might deal with a different bank. We deal with Optum Bank here at the college. The next employer might deal with a different banks, so that could change, but the rules of the HSA are the same. And nobody is policing these accounts. It's not like a flex spending account, which I don't have on my agenda today. That's a different kind of savings account. Those you have to save in a year and you have to submit receipts to get reimbursed out your own money. Okay, so we're not talking about flex accounts. For these HSA accounts, no one's policing it. So I don't check on our employees and say, did you spend that $750 correctly? That's on them. If they're audited by the IRS, they need to make sure they have enough health insurance expense receipts in a folder to show the IRS to say, yeah, I didn't buy a television. I actually had health insurance, health expenses, and this is what I bought with my HSA money. But it's the same across the board.
Yeah, but you're not buying like toothpaste and like soap
No.
with your HSA money.
Not really, but you are buying a lot of things over the counter. For instance, my eyeglass frames. If I want expensive designer frames, I could buy my eyeglasses with that. Any dental work that you have done, all your health insurance, you're going to mostly probably use it for deductibles and copays, and anything that's out of your pocket towards a health expense is going to be eligible. And you could Google HSA store and you'll see there's an HSA store. You don't want to buy from them because I think they're expensive, but you can see all the items that are eligible under that. And it's a long, long list.
Great. Thank you.
Yep, sure. Okay.
So this is just a quick clarifying question about the HSA. So is that specific to your place of employment, or does that stay with you if you leave that employment to another place?
So it stays with you. Once that money is in your bank account, it's your bank account. The college, your employer will open the account for you, and hopefully they'll put money in. They don't have to, but hopefully they would. You can always put money in, but that money is yours. If we put $750 in everyone's account in January and they leave us in February, that money's theirs. The minute it hits that bank account, it's your bank account. So if you go to your next employer, if they have a qualified plan and an HSA, you could transfer your HSA dollars all into their new one so that all your money's in the same place, or you could just, drain them individually, but they're your accounts. They stay with you forever. You control them.
Gotcha. Thank you.
And it's nice that you don't have to submit receipts to get reimbursed. You actually just use the money appropriately and save your receipts. Some people are really slick about it. They say, you know what, I get a lot of travel points if I use my Visa or MasterCard. So I'm going to go ahead and pay all my health insurance bills with my personal Visa card and get my travel points. And then I'm going to go into my HSA and transfer funds from my HSA bank account to my personal bank account to reimburse myself. And that's fine because you're reimbursing yourself for eligible health expenses. So some people really are learning how to use the system pretty nicely. Okay, so I'll keep thinking about other things to tell you about that because it goes on and on. There's a lot of interesting things about HSAs. There's also a lot of stuff about it that I'm not touching on today. Like, people who are on Medicare aren't eligible for HSAs. So we have a group of employees that we have to do something different for in that regard. Same with like TRICARE. Any sort of government coverage that you're involved in would make you ineligible for an HSA. So there's some different caveats that you would need to know along the way, but I don't think there's anything that really pertains to you as young professionals just heading out into the world of work. Okay, so just one quick screen on dental and vision coverage. Of course, you want these as well. Often they're bundled with your regular health insurance. Like here at Gettysburg, our Highmark Blue Shield covers our health insurance, our vision, and our prescription all bundled together under one premium. And our dental is carved out separate. So each employer may have it a little bit different than that. Take advantage of the vision. Our vision is once every year we get a free eye exam. Go get your free eye exam. And then they give us $60 towards our frames and $75 towards contact lenses. So often our lovely frames cost way more than $60. So you could just use your HSA money to pay the difference. You want prescription sunglasses, go ahead and pay for them out of your HSA. If you have dental work, often dental coverage covers some, but not all of the money that you may owe. So you pay the balance of your out-of-pocket expense with your HSA. And then life insurance. A lot of employers offer life insurance. Some employers pay for that life insurance coverage as long as you're an active full-time employee. That's what we do here at the college. But we also offer them the employee to buy additional life insurance. And so you can do that at any time throughout life. But if you're younger, in good health. So you'll have to decide for yourself when's the best time to jump into the life insurance policy. But at some point you're going to want to have a nice life insurance policy in place. Okay, so those are the basic benefits, medical, dental, life, vision. Of course, your employer might have additional benefits. You're welcome to go to our benefit website. My site has every benefit we offer. It's open to the public. You can go in and look around and see if you have any questions about it. If you're really interested, I hold benefit review meetings that are very specific to the benefits we offer here at Gettysburg College. I do them once a week for different types of employees that come through. You're welcome to join one of those reviews if you would like to, and just listen in and hear all about the benefits that we offer, because I go into a lot of detail about some other things that we're not talking about today. Okay, all right, I'm going to talk about retirement because I think it's so important for young professionals to really think about this. It's interesting, but I really think the best time to think about retirement, it just seems so strange, is the very beginning of your career. The sooner you start saving and investing for retirement is the more time you have to take advantage of compound interest, which is for real. Okay, so before I get into the nitty-gritty of this, the younger you are, investing in your retirement in your 20s versus your 40s versus your 50s makes a significant difference when it comes time to retire. You will be so happy with yourself that you started at a young age. My 4, again, young adult children, that's the very first thing I made them do. As soon as you see what your employer's offering, is it a 401k? Is it a 403b? Different types of retirement plans for different types of employers, whether it's a for-profit corporation versus a nonprofit organization, they're going to have different types of investment options. But the important thing is jump in. I had my young adult children jump in as soon as they could, because they started at the very beginning of their careers and they're like amazed at how it's growing. And of course, they're not allowed to touch it. You can't touch it till you retire, and don't even watch it. Don't follow the market and say, oh, I'm going to take it out and put it in. Don't do any of that. You can do that outside of your retirement plan. Go ahead and buy a one-off stock and play around with that if you want to, but your retirement investment with your employer, set it up, contribute, and forget about it until it's time to retire, and you'll be so happy. Okay, so compound interest. Compounding happens when earnings on your savings are reinvested to generate their own earnings, which in turn are reinvested to create more earnings, and so on. Over time, compounding can add a lot of fuel to the growth of your savings. So getting an early start on savings can pay off in a big way. Let's look at Kate and Andy, examples of how they're investing. So each saves $30,000 over 20 years, $1,000 annually for the first 10 years, $2,000 annually for the second 10 years, and the contributions are made at year end, which probably wouldn't be the case for you. You would do them throughout the year, but whatever. For this hypothetical, they contributed at the end. Each achieves a hypothetical 6% annual interest. Okay, so scenario 1, Kate starts investing at age 25 and she stops at age 44. Her total amount saved is $30,000. At retirement, age 65, she has $160,300. So scenario 2, Andy doesn't start till 45 and stops at age 64, and his total savings was the same, $30,000, but he only has $49,970, and the difference is compound interest. So Kate, her money, her interest reinvested itself from age 25 all the way to 65. And what a difference it made, 160,000 versus the 50,000. So that's compound interest. And it really is just such a powerful thing. So it's all in the math. Nothing demonstrates the power of compound interest more than the numbers 7 and 2, especially to savers with plenty of time on their hands. So here's how it works. The first rule of 72 states that an investment with an average annual return rate of 7.2% is set to double every 10 years. So the rule is if 20-year-old Sarah invested $1,000 today and just left it there until she retired at age 70, she would have around $32,000, 32 times what she originally invested. Similarly, if you assume a 10% rate on your return, you double your money every 7.2 years. So Sarah at age 70, her balance would look more like $128,000, 128 times her original contribution. So if you leave the money alone by itself long enough, it can really start multiplying for you. So on the flip side, this is good to know as well, the 72 rule applies to credit debt as well. So just like the accelerated growth on the savings, the same thing can happen in the opposite direction when your debts compound. So credit card providers, they charge, more than 10%, which means they're making a lot of money very fast on us if we use our credit cards. So for the sake of the argument, Sarah has a sister, Julie, and she owes $1,000 at the rate of 10%. If she avoids payments for 7.2 years, she would double her debt. So fortunately, most of us aren't going to just throw our statements aside and ignore her debt in 7 years. So that $1,000 shopping spree at a borrowing rate of 10 to 18%, most credit cards are at least 18 to 21%, is costing a lot more than that original $1,000 price tag. So you just have to think about that. So remember that when you're using your credit card, you want to really try to pay them off the complete balance within the month that you purchase so that you're not paying any interest, or if they have an interest free for 6 months, make sure that you pay it off by the time that 6 months is over. So understanding this rule can really benefit you both in savings for your retirement compound interest, and also, again, the flip side of how it compounds your debt should you have a credit card debt. So again, if possible, start investing in your retirement at the onset of your career. This year, again, the government controls how much we're allowed to contribute, how much of our voluntary money we're allowed to contribute to a retirement account. It's a pre-tax contribution. So the money goes in pre-tax, which helps with your taxes on your day-to-day paycheck or week-to-week paycheck. But when you pull the money out in retirement, they will be taxed later. So the maximum that we're allowed to contribute in the year 2022, if you're under age 50, is $20,500. And if you're over 50, it's $27,000. Well, I can tell you from my experience as a benefit person here at the college, most people are not in a position where they can contribute this much in a year. Maybe some of the folks who are pretty close to retirement and making a pretty high salary might be in a position to do this, but most of us don't come anywhere near these maximums. But it's nice to know what you could do or what you're allowed to do each year. So what I say, a good thing to think about is do not leave free money on the table. So always try to match what your employer contributes. So for instance, if your employer says, hey, we have a 5% match here at your ABC company, which means I'll match you, the employer will match and contribute up to 5% of what you do. So if you put 5% in, your employer is going to put 5% in, and now you're saving 10% into your retirement account. That's great. If the employer says, we'll contribute up to 5% match, and you only put 3% in, the employer is only going to put 3% in, and you're leaving 2% of free money on the table. So don't do that. At the very least, see what the employer matches and put that much in. If they're matching up to 5%, put 5% in. If they're matching up to 3%, put 3% in. Put more in if you can, but at the very least, try your best to get that employer match. Okay. I think it's a good idea. Let's see, let me read my slide before I skip around. Okay, so we did that. So best practices, I think it's a good idea to set up an automatic 1% increase each year, either the beginning of the year, or sometimes you get a salary increase, a raise every July, set it for then. When you get a salary increase, it's a nice time to do it because you're already used to living on less money. You won't even notice the increase. So if your employer allows you to do an auto increase, do it, just 1%. You won't even notice the difference that every January now you're doing 6%, and the next year you're doing 7%. Before you know it, you're making a real solid contribution to your retirement. Of course, you need to look at the rest of your life. You have, again, like we mentioned earlier, you have rent and food, and you have maybe your HSA you're contributing to, and you have to pay premiums for your health insurance and your dental insurance, and your car tires blow out. So each employer is going to run this program a little differently. Here at the college, I let our employees change the amount they contribute to their retirement and their health savings account at any time throughout the year. I don't want anyone to feel stuck, like, oh my gosh, I'm putting $50 every pay into my health savings account and my car just broke down. I need to stop that for a while. Go ahead, stop it. Start it back up when you have liquid money again. Same with the retirement plan. I let them start, stop, and change that as often as they want throughout the year. So that's a question to ask your employer. Some employers are like, nope, you set this up during open enrollment. Once a year, you have open enrollment to make your elections for the next year, and you're kind of stuck, or you're in that for the whole year. So you want to kind of ask that question: what kind of flexibility do I have in making these contributions throughout the year? But you're not going to go wrong setting up a 1% annual increase to your retirement plan. So you have full control over how the funds are invested. Each employer is going to have a really nice investment platform of choices for you to make. Like, they'll have large gap, small gap, real estate, social choice. They're going to have this long list of investment options. And you can say, yeah, I want 10% of that and 30% of that, or 30%, 20% of this. Most of us have no idea what they are. Some people really follow the stock market and they really understand overseas investments versus, international versus domestic, large gap versus small gap. There's a lot to that arena, and some people are fascinated and know a lot about it. And that's great. If you're one of those people, some of our employees are in there every night following the stock market and changing their investments around. Others, most people really know enough just to be dangerous, so they kind of shy away from it. So the first thing you should do is all of these investment houses, Fidelity, Vanguard, we use TIAA. They have financial advisors that you can go to. We bring our financial advisor to campus every month to meet with our employees who want to meet with them one-on-one for free consultations. So if your company has something like that, take advantage of it. But talk to those financial advisors. Let them invest your money for you. If you really don't know what to do, let them do it for you, because they're going to put you into something called a target date fund or a life cycle fund. And they're wonderful. It's sort of a set it up and forget it. It's based on your age. So the younger you are, they're going to start you off on a very aggressive type of investment pattern, because you have a long time before you're going to retire. And that market's going to go up and down a million times before you retire. So that's why I say don't watch the money. It's going to go up and down, and don't worry about it. By the time you retire, it's going to do that a million times. And you only need to really worry about it when you kind of get close to retirement. Well, now I'm going to start putting my money in something more conservative because I don't want to lose it right before I need to use it, right? So someone who's a little older starting this, they would put them in a life cycle fund based on their age. So if you're a little bit older, it's going to be a little less aggressive. It's going to be a little more conservative, and it'll invest that person appropriately. So that's a really nice choice. The life cycle funds, or they're called target date funds. So ask about those. Okay. Okay, so that's my PowerPoint. So we talked about health insurance, a couple different types of plans, some terminology. We spent some time on health savings accounts, and then I really went into retirement. There's many other benefits in the world, but those are the key ones that I thought might be helpful for you as you start to think about this. Don't be afraid to ask questions to the HR folks at your company. The beginning of your hire is hopefully they'll have a benefit review like I do for people. Some companies it's just online and you're reading it on your own. But if you have questions, there should be hopefully someone that you can ask a question to. So don't be afraid to ask questions. Every year, the company should have an open enrollment. We do ours in the fall. We open up a dashboard to all of our employees and say, okay, go online and make your elections for next year. I hold meetings across campus during open enrollment for people to explain the benefits and for them to ask me any questions they might have. So open enrollment's a good time to make changes and as a new hire. Also, if you have a life event throughout the year, that is a legitimate reason to make a change to a lot of these benefits. So if you get married, unmarried, have a child, those are chances to say, you know what, my new spouse wants to come on my insurance, or hey, I'm jumping out of your insurance because I'm going on my new spouse's insurance, or we had a baby, add my baby to the plan. Same with life insurance. You're going to pick your beneficiaries. In the beginning, it might be your parents or your siblings. Over time, if you get married or have a significant partner, you want to make sure that you add your partner or spouse as your beneficiary, not your parents. So those are things that you want to kind of think about as you go through your life. Okay, I'm going to stop and open up the floor for questions. Or is there anything, a benefit that you know of that I didn't talk about that you'd like me to speak on?
Yeah, so when 401k money is taken out after you retire and that's taxed, like how is that taxed according to your income in that year, or is it taxed otherwise?
I think, because I'm not a tax advisor expert, but I think it's taxed based on your income for that year. And so what a lot of people do, especially when they get to mid to late career, they really get in touch with financial advisors, because that advisor might say, you know what, it's time for you. And it might even be time in the beginning of your career to open a IRA, which does kind of the opposite. The money goes in after tax, and then when it's pulled out, it's not taxed. So some people have both types of investments to kind of balance each other out tax-wise. But there's all kinds of ways to shelter tax through life. So depending on the rest of your portfolio, if you own real estate or some kind of equipment or a business, I mean, each scenario is really different. So you definitely want to talk to a financial advisor at the onset of starting this investment, maybe midway, and then again at the end. Just to, at the end, they're going to talk to you about all the different ways you can draw your money. You can annuitize it. You can annuitize some and draw others. You can take it as a lump sum. There's a lot of different ways that you can draw your money at the end, and that might make a difference on how it's taxed. There's extra benefits. You heard of AFLAC with the duck, right? We have AFLAC policies they wrote for us. Our employees are welcome to purchase those. Those are additional benefits that are not for everybody. You just decide whether or not you want to buy it. There's United legal benefits. If you have legal concerns, we have a benefit for that. We have long-term care insurance. Some people want that, some don't. We have an EAP. Hopefully all employers will offer an employee assistance program. For us here at the college, we work with WellSpan. It's our local health system. And so our employee assistance program gives each of our employees 3 confidential counseling sessions for free each calendar year. And it extends out to their immediate family members. So if my daughter wanted to talk to a counselor, she could go through our EAP. It's nice because here, like in our Adams County area, in a lot of counties, especially now throughout the country, sometimes there's a long waiting list to get into a counselor. So the WellSpan EAP can sometimes help get you in to see a therapist or a counselor faster. So that's really nice. And then also, most insurance companies now offer telemedicine, both for physical and for mental health. So ours does. Highmark has a 360 virtual medical program where I could log in right now and speak to a counselor, just like we're speaking through a Zoom session, or a healthcare provider for a physical concern. If I think I've strep throat, I could, talk to a doctor just like this, and they would write a script and send it to the pharmacy without me leaving my home. So that's a nice that's a really nice benefit that has really become much more popular over the last couple of years. So you'll want to see if your plan offers that and take advantage of it. So some key takeaways: stay on your parents' insurance if you can, at least know that that's an option. Save for your HSA. If you're on a qualified high deductible plan, do your best to put as much money in as you can, because it's your money. It's going to roll over year to year into retirement for you. And start saving for retirement as soon as you possibly can. You'll be happy with yourself when it comes time to retire.
Where can we access this recording later on, if possible?
So that's a great question. I didn't actually set up the J term recording of this, so I'm sure Rod Tostin, the folks who are in charge of the whole J term will make that information available to all of us. But my email, I'll share my email if any of you would like to email me and ask questions later and ask that question, hey, how can I get the recording? I'll certainly research that for you. If you want to join a benefit review of mine or just stop by and see me and ask questions individually, you're welcome to do that. So I'm Karen Ray, and my email here is kre@gettysburg.edu. Real easy. My last name is just 2 letters, RE, kre@gettysburg.edu. Okay, well, I thank you very much for letting me present to you. I think this J term is real exciting. I was really happy to see that it was coming back. I know they used to do J terms years ago here at Gettysburg College, so I think it's a wonderful opportunity for everybody, and I'm happy to be a part of it this year. I wish you all great luck in your the rest of your college career and into your first careers in life. Hope it goes well for you, and if I can help you in any way, just let me know.